So good afternoon, everyone, and welcome to our patient education meeting that's focusing on advances in kidney cancer treatment. I'd like to welcome all the people we have on our webinar today. Thank you for joining us, and thank you to everyone who's made the trek into Toronto on a very rainy, mucky day, and thank you for missing this Black Friday sales to be here. We do appreciate that. My name is Heather Chappell, and I'm the Executive Director of Kidney Cancer Canada. We're going to first jump into the presentations. We do have Dr. Finelli coming in, and so I'm going to start talking a little bit about Kidney Cancer Canada, and as soon as Dr. Finelli is able to join us, we're going to switch over and jump right into his presentation on surgical advances and the role of biopsy. So we appreciate your flexibility as we may be jumping around a little bit, but we have plenty of time for questions, and for those of you on the webinar, we do have plenty of time for your questions as well. Okay, so I'm going to start a little bit just to give a background about who we are, Kidney Cancer Canada. Okay, so we were founded in 2006 by patients and for patients. We're the only Canadian charity that's focused exclusively on kidney cancer. So you know that everything we do has the sole purpose of helping people who are have the kidney cancer disease. And we have grown over almost the last decade from 2 patients up to 2,000, a network of 2,000 patients and caregivers across the country. So our vision is to improve the lives of Canadians who have been touched by kidney cancer. And when we talk about Canadians who have been touched by the disease, we talk both about patients, caregivers, as well as survivors. And we accomplish this mission by advocating for access to treatment. And that's why we're talking a lot about the advances in treatment today, because that's an area that's having a lot of changes over the last couple of years. Promoting research, as well as providing support and information and education. Okay, and how do we do that? We stay very busy with advocacy and government relations. And when we talk about advocacy, it's not just the formal advocacy that we do with the government, but it's also advocacy for the patients, giving the patients the information and the support that they need to be able to advocate for their own health and their own treatment in the health system. We do patient support, education, and resources. So events like today, our webinars, we also have a lot of information on our website and through videos. We go through awareness and outreach, making sure that we're raising awareness about the impact kidney cancer has in Canada, about how the rates are continuing to rise and that we need to continue to focus on the treatments for this disease. Research funding and engagement, we're a very proud partner of the Kidney Cancer Research Network of Canada and funding projects there. And we're also part of formal and informal partnerships and collaborations. So how do we do this behind the scenes? We have an incredible board of directors who are across the country, making sure we have that national representation. We have 3 staff who are very busy trying to support all the work that is happening across the country, and of course, many volunteers across the country. We also are very closely connected to our research and clinical experts in Canada. So we have a very active medical advisory board. As I mentioned before, the Kidney Cancer Research Network of Canada, and we also have a Kidney Cancer Nurses Network, so we're staying very engaged with both the clinical and research community. So this is just a nice screenshot of our website, and some of the things you would find on our website is the discussion forum, and that's a place where you can go to talk with other patients and other caregivers about your experience, share what works, share new things that are on the horizon for you. So it's a great place to go to learn from each other. We have the interactive map so you can see who else is in your area. You can connect with people who are directly in your neighborhood. We have educational videos. We have our live webinars such as this. We also have some tips and tricks. We've got questions to ask your doctor, and we also have both in French and English top 10 tips for surviving kidney cancer. Some of our key partners, and these are some of the formal coalitions that we partner with. We very much focus on if there's an issue that affects cancer patients beyond kidney, we like to work together to be able to accomplish those goals. So we're formal members of the Canadian Cancer Action Network, the Cancer Advocacy Coalition of Canada, Best Medicines Coalition, the Canadian Association for Rare Diseases, and the Health Charities Coalitions of Canada. And that's just another way for us to have our voice heard. We're also very active members of the International Kidney Cancer Coalition. And in fact, one of our speakers today, Deb Maskins, is the vice chair of that organization. And well, I just want to check on timing.
Yes, so when you're finished with your slides, Heather, I'll need just a couple minutes to get Dr. Finelli's uploaded.
Okay, so I will zip through these because I think certainly, again, Deb Maskins, who is our third presenter today, can do a lot more justice and answer your questions around some of our partnership work. CanCertainty is another partnership coalition that was spearheaded by Kidney Cancer Canada, looking for equality in access to take-home cancer medications. And those are all the partners that we brought together to try and tackle this very important access issue. As I mentioned before, the International Kidney Cancer Coalition is another group that we are very active with, and that's sharing knowledge and best practices with other kidney cancer organizations across internationally around the world. And our sponsors, how are we able to do all of this work? Well, we're very lucky. We are a registered charity, so we do receive individual donations from Canadians, corporations. We have a lot of people who host fundraisers with the proceeds coming to us. We also receive sponsorship grants from some corporations, both unrestricted, project-specific, and event-specific, just like this one. And of course, you. Sharing your story, volunteering your time, and becoming monthly donors are very important ways how we're able to continue to do the work that we're doing. And that's just a couple of quotes, one from a clinician in Toronto, as well as one of the patients about the value of Kidney Cancer Canada. And lastly, this is how you can get in touch and make your voice heard. Again, we're very active online, both our website, social media. You can call us, you can email us. We will connect with you any way that's convenient for you. Please don't hesitate to reach out to us. And lastly, we're here for you.